Thank you, Mr. Chair, Madam Co-Chair, dear colleagues, friends. Before I started to work on this presentation, I did a quick survey among my friends who are sitting in this room in terms of understanding their perception of what does it mean, sustainability, and how they perceive sustainable programs. And it was interesting to see that some of you looked at the sustainability through the perspective of producing and maintaining their health outcomes. So from the lens of the benefits. Others look through sustainability in terms of ability to ensure program activities, to basically institutionalize those new programs that we work and scale up in the region. And others look through sustainability in terms of the capacity. So we try to combine all in one definition. What does it mean, a sustainable program? And this is a program that is able to deliver products and services to generate the expected outcomes and achieve its goal, but in a cost-effective manner. So having that in mind, we started to look on the region in terms of is it sustainable, where we are in terms of building that sustainability. And of course we look through the first of all on the public spending, because that's the most let's say indicator in terms of sustainability and financial sustainability in the region. We have money. At the same time, we spend those money not wisely yet. I will show you a bit later some figures, but in terms of governmental takeover, what we observed is when the government is ready to take over some activities in the national program, most likely they support so-called essential services, treatment, diagnosis, equipment, supplies, and so on. And less likely they support community-based activities, less likely they support NGOs involvement, community involvement, and so on. So basically, we register quite a gap in terms of supporting complex interventions as treatment and prevention activities among the key key affected populations. And when we look on how the money are spent, and as Professor Kazachkin mentioned, as our epidemics is concentrated among key affected populations, logically you would expect that the majority of the funds are oriented there. So there is not such logic yet in the region, and we see only about 11% of the funds going for the activities targeting key affected populations. These are the figures that I wanted to show you, and the column which is in the middle basically shows you that public spending out of the overall spending in the programs at the domestic level. So basically you see a trend of increase. You see that more than a half of the costs are already supported by the governments in terms of the national programs. However, you can see some countries that are still behind, like Armenia, like Georgia, Moldova, Tajikistan, which the share of the public spending is less than average in the region. And of course, you see the last column in terms of the harm reduction interventions and the costs that are part of the national programs. And you see that is quite low. So Indeed, we in the region depends very much yet from the external funding from the donor. Because the government is taking over those programs that are not related to the community-based activities, we see that those activities are in major are funded by the external funding. And we noticed several experiences already in the region, like Romania, when Romania was a recipient of the Global Fund in the past, and when they joined European Union, basically the government was pushed to take over the costs of the disease-related programs in the country. So basically, they faced a big problem in terms of supporting community-based programs in Romania, but also they had some problems in supporting basic services like treatment as well. So, and we also notice now in the region the same tendency that we see in Balkan countries, that some of them are graduating very quick from the external support. And there is no transition plans yet in place in terms of building a sustainable approach to supporting the national programs. The Global Fund remain basically the major donor in the region. You see that they contribute a lot for the AIDS response in Eastern Europe and Central Asia. New funding model push the governments to look through a new lens in terms of transition. I don't like the word graduation, but basically that transition from the support of the donors to the sustainability and supporting your own programs in the country is basically embedded into the new funding model. You see some requirements in terms of pushing governments and differentiated approach in terms of counterpart financing. You see different requirements of the Global Fund to countries depending of the income level, 20, 40, and 60% of the counterpart financing. There are already some requirements in terms of having oriented those programmatic funds to at least half of them to the key affected populations and activities targeting those populations. We already see that there are requirements in terms of supporting those services that are essential in the countries in terms of treatment, laboratory services and support. So there are, again, it's differentiated in terms of the income of the countries, but generally, as Professor Kazachkin mentioned and Dasha as well, we have to frankly say that the Global Fund will not support long the region. We expect that in 3 years from now, the support from the Global Fund will be reduced and essentially in the country, in the region. And of course, the Global Fund requires countries to look and develop smart programs in terms of transition. When we talk about sustainability, of course, we need to touch costs and prices, efficiency, effectiveness. Efficiency, I would put an accent on effectiveness, because efficiency is how well the programs generate the results, but we are in health more interested how useful are those results for the individuals and populations. We need to look through the systemic factors, and you see in previous speakers mentioned health systems, primary health care, vertical programs, of course corruption, which is another epidemic in the region. Procurement, we do not use in the region yet the tools that procurement will and can influence the price reduction in terms of procurement of equipment commodities. And of course, we have already experience with some countries, Ukraine, Georgia, and Moldova, in terms of negotiating association agreements with European Union, bilateral agreements, where the European Union impose additional trade-related intellectual property rights to those countries. And all these topics are probably can be topics for a separate conferences each. The last slide in terms of what we can do and what we have to do, I would say that we need to be just smart, and we need to invest smart. We need to prioritize better and make our budgets to reflect those priorities. We need to implement those innovative approaches that Dasha described to you earlier, those who are patient-centered. We have to keep in mind that TB is the main killer, and TB should be embedded in all our programs. Social contracting, Professor Kazachkin mentioned, that's a very important issue in terms of sustainability, in terms of ensuring that those services and programs that we started are maintained further and sustainable. We need to institutionalize those innovative programs, develop smart plans in terms of the graduation, and of course we need to bring and hold the government accountable in terms of our programs, and advocate for further ownership and takeover. And at the end, when Dasha said that she is pessimistic today, you remind me a good saying in terms of the difference between the pessimistic and the optimistic person. The pessimistic person is the same as optimistic one, but well informed. I hope that after our session, you are not getting to be all pessimists. We need optimists to work further on our programs in the region. Thank you.